If you are pregnant, or your wife is pregnant, or your sister is pregnant, your sister-in-law, your friend, or anybody you know, a woman who is pregnant and doesn't know the day she will deliver her baby, then this video is for you. Yes, you. In this video, I'm going to teach you how you can calculate your EDD, estimated date of delivery, at your own convenience. You don't need anybody's help to do the calculation. It's very simple. Just sit and watch. If you're coming across my video for the first time, welcome. My name is Ifechukwu Prudensiano Okachukwu. I'm a registered nurse, a midwife, and a family planning provider. I film health-related content, especially family planning and reproductive health. If this is the kind of content that you are interested in, keep watching, and please consider to subscribe to my YouTube channel at Nurse Prudence. For you to know the day you are going to deliver your baby, we are going to make use of the Nagel's rule. This rule says that you are going to take and make use of the woman's last menstrual period, add 7 days to the day, minus 3 days from the month, and then add 1 to the year. That will give you the estimated date of delivery for that woman. Very simple. Just keep watching. So now let's assume that the last menstrual period for the woman was on 20th of June 2023. Last menstrual period, that is LMP, 20th of June 2023. Now, you have to write it down like someone who is trying to solve mathematics. That is 20th, and June is 6, right? Yes. Then 2023. Now, the rule says you have to add 7 to the number of days. So 7, this is 7 to 20th of June. Then minus 3 from the month. This is the month, which is June, minus 3. And then add 1 to the year. And when you add up this, you will have 20 plus 7 is 27. 6 minus 3 is 3. And then 2023 plus 1 will give you 2024. And this woman is estimated to deliver her baby on the 27th of March. 27th of March 2024. This is very simple. So once you know your last menstrual period, that is the only thing you need, and you are good to go. So remember, Nagel's rule said, make use of your last menstrual period, add 7 to the number of days, minus 3 from the months, and add 1 to the year. And that will give you this. Very simple. Now the question is, in a situation whereby here we have like January, February, or March, how will you minus 3 from the month? When the month is already January or February, how are you going to minus 3 from 1, or minus 3 from 2, or minus 3 from 3? How will you get an answer? And in a situation as well, when the number of days is already like 30 or 31, when you add 7 to a number like 29, 30, 31, you'll be getting like 36 or 37. There is no month that is 37 in number. The highest we have is 31. In such situation, how are you going to calculate it? I will teach you that now. So now, in a situation whereby the number of days is more than 31, because there is no month that is more than 31, this is how we are going to do it. So let's assume that the last menstrual period was on 30th of June. This is 30th of June. And for you to do it, you have to write 30, and June is 6, then 2023. According to the formula, you add 7 to the number of days, minus 3 from the month, and add 1 to the year. So this is plus 7 minus 3 and plus 1. When you add 30 plus 7, you will have 37. Then 6 minus 3 will give you 3. And 23 plus 1 will give you 24, right? Yes. Now, there is no month that is up to 37. How are you going to do this? What you will do is that the month that is here, which is March is 3. How many days are there in March? We have 31. So you minus this from this month, and you will have 6. In other words, when you minus this number from the number of months beside it, you have a number which is 6. And this formula will be plus 1. In other words, you carry it over to the next month. When you do it plus 1 physically, or you do it off heart, like you carry it over to the next month, because there is no month that is 37. So you minus the month, and then it means you are moving over to the next month. So this should be 6th of April, which is 4. So 1 plus 3 is 4. And already, you know that March has already ended. So the extra 6 days should be for April. Do you understand it? Then 2024. So this woman is expected to put to bed on 6th of April 2024. It's very simple. Whenever the number of days is more than 31, just minus it from the month beside any numbers remaining. Any number remaining will be for the next month. That is how to do it. It's not hard. If you are confused in any way, pause, replay, watch it again over and over again. You will understand it. Now, the next question is, what if the month is January, February, or March? How are you going to minus 3 from it? Watch and see how we are going to do it. So now, whenever the month is either January, February, or March, there is no way you minus 3 from it. Because according to the formula, you minus 3 from the month, add 7 to the number of days, and then add 1 to the year. So now, we have 20th of January. January is 1, 2023. You cannot minus 3 from 1. It's not possible. And we have 2 formulas for doing this. Number 1 is, because pregnancy lasts for 9 months, all you need to do is to do plus 9 here. And still add plus 7, which is the normal standard here, and then plus 1. When you add it, what you will have is 27th of October, which is 10, 2023. Now, let me tell you something from this. I just wrote this thing to draw your attention. Whenever the month is January, February, March, or whenever you are making use of this method of plus 9, you do not add this. There is no addition or subtraction. in the month and the year, because it will still be the same year. Hold on. Whenever the month is January, February, or March, and we are making use of the 9 months method, please do not include the -3 and +1 for the year, because the EDD will still be the same year when you are using +9 method. Just like you can see here. Even if it is February, when you add 9 to 2, you are still getting 11, which is November, the same year. Even if it is March, which is 3, 3 plus 9 will give you 12, which is December, the same year. So whenever you are using the +9 method, do not include +1 under the year or still a -3 from the month, because you are using extra method. This is the first method. The first method. The second method is whenever you see January, February, or March, what you are going to do is continue counting as 13th month. You will take January as 13th month. Already, December is 12. So you will continue like that to take January as 13, February as 14, and then March as 15. That is where you are going to end, because April can -3. Or rather, you can -3 from April, which is 4 minus 3. You will still get 1. Do you understand what I'm saying? I said that the second method is you taking January to be the 13th month, February to be the 14th month, and March to be the 15th month. Only when you use such method that you are going to adopt the full method or formula for this. So let's assume now that we have 20th of January, which is 2023. Now, when you take, this is +7 as usual, when you take January to be the 13th month, which is 13, you take it to be the 13th month, you now write -3 and then +1. It is only with this method that you can now add the -3. So when you do it, you still get 27th. 13 minus 3 will give you 10. So when you do it, you will still get the same thing. You will now minus 13. You now minus 3 from 13 and you will still get 10. And remember, I said, whenever the month is like this, you're not going to supposed to add anything like 1, because it will still be the same year. You're not supposed to add +1 under the year. Whenever it's January, February, and March, the year will still be the same thing. I hope this is clear. Use any method you like. This may be simpler for some people and this may be simpler for some people. I think this is better. So you use the first formula whenever your month is January, February, or March. Your last menstrual period is January, February, or March. You just add 9, which is 9 months of pregnancy. You just add 9 to the month, and that's it. You will get your EDD, the estimated date of delivery. I hope this is helpful. Please like, comment, and share. Let me know your opinion in the comment section, the method that you have been using. If there is any question or anything, any suggestion, I'll be right there to answer you. Until I see you again in my next video, do take care of yourself and drink plenty of water.